One of the biggest lessons that I've learned through posting on social media is just how deep the public distrust in the medical system runs. And that's part of why I started sharing my experiences, to contribute to public health education and to shed light on what I see every day. Early on, I posted about one of my biggest fears as a doctor, addiction. I work in downtown Vancouver, where my hospital serves the downtown east side, one of the poorest neighborhoods in all of North America that has a very high concentration of people who struggle with mental illness, addiction, and homelessness. And these are the people that I care for every single day on the job. In that post, I shared that I personally avoid using prescription pain medications, even when I had a herniated disc that left me in debilitating pain over a 9-month period, forced me off work, and required 2 spine surgeries. But then an influencer from the chronic pain community picked up my post, twisted my words, and told her followers that because I personally choose not to use prescription pain medications, that I would not administer pain medications to patients that actually need it, making me an evil doctor. And this couldn't be further from the truth, because in the ER, I treat pain every single day, both acute and chronic. I administer and prescribe opioids when they're needed, because one of the core duties of being a doctor is to alleviate suffering, and that's something that I take very seriously. Still, her post led to waves of trolling on my accounts, including some of her followers sending me hateful messages and posting comments about how they hope that my mother suffers and dies from cancer. And this is all based on distortion. But one point that she did make that I actually do agree with is that the pendulum of how patients and pain are treated has swung back and forth quite drastically over the years. So in the early 2000s, opioids were pushed very aggressively by pharmaceutical companies and doctors that led to the opioid epidemic that killed countless people. And because of this, in recent years, the pendulum has swung in the opposite direction, where some patients with real illness are unfairly dismissed as being drug-seeking, even when what they need is real treatment, including pain medications. This is an area that I agree healthcare staff need to rebuild the patient's trust so that the doctor-patient relationship becomes more collaborative instead of adversarial. So I think social media can act as a very powerful tool for facilitating constructive discussions, but it also very frequently acts as a vehicle for misinformation and extreme toxicity and vitriol. And I'm still only a couple of months into sharing my experiences on social media and still trying to figure out if the positive impact on public education outweighs the negativity that comes with it. But let me know what you think.